Well, I think when you deal with heart failure, the big conquests that remain to be done are about prevention. Certainly drug therapy, especially beta blockers, ACE inhibitors and A2 blockers, have gained a lot of life for heart failure patients. But in spite of that, some patients, as we see in reverse and CRT, do have poor ventricular function in spite of having had optimum medical therapy. And for those patients, I believe that we do have a possibility to delay disease progression, or even for some patients reverse the condition back to nearly normal. And this is something new, and this is something that really is a big breakthrough in heart failure management.
Well, I think it's been one of the remarkable success and consistent success stories of CRT is the improvement in ventricular function, and we've seen that right the way through from the Miracle trials, CARE-HF, Reverse and Made It CRT. In all of these trials we've shown a very consistent modification of ventricular function. And that's very important in terms of disease modification, but then trying to link the disease modification to the impact of the treatment on outcome gets even more interesting, because when we do that, there's very little evidence that the etiology of the ventricular dysfunction changes the effect of CRT on outcome. It didn't make an effect in CARE-HF. If you look at the harder outcomes and symptoms in the reverse, then it doesn't matter what etiology you have. It doesn't seem to matter very much in Made It CRT what etiology you have. So in terms of the clinical benefits to patients, it doesn't seem to matter what the etiology is, but it does have a big bearing on the improvement in ventricular function. And that implies that CRT is doing something else. It's not just the improvement in ventricular function which is leading to benefits with CRT. There are other factors at play.
I would also like to point out that reverse remodeling is something that happens very fast at the beginning, but that continues to evolve over at least 18 months, as indicated both in CARE-HF and in reverse. In Made It CRT, they only measured it after 1 year, so there I don't know exactly how it went on, but it's progressive, and it's much greater in dilated cardiomyopathy patients. However, I agree that there must be an element beyond reverse remodeling that helps patients in CRT treatment, because the ischemics derive the same benefit in terms of heart failure hospitalizations as do patients with dilated cardiomyopathy.